best friend suffers from depression. She received her diagnosis in high school, and I have watched her struggle with the disorder since that time. She speaks with a therapist on a regular basis, alternates antidepressants often, and continues to struggle with the highs and lows of her disorder. My friend is not alone. Depression is a major medical condition that affects millions of people worldwide. In fact, it is the leading cause of disability in the U.S. Edward Shorter wrote a book called How Everyone Became Depressed. And in this book, he mentions that on a lifetime basis, 1 in 3 Americans will receive a diagnosis of depression. Of those people receiving a diagnosis of depression, they will exhibit a multitude of different symptoms. Which begs the question, is depression causing the symptoms, or is depression itself a symptom of something bigger? It's surprising to know that we actually know very little about the brain. Clay Reed, a scientist who studies the brain through a series of experiments called MindScope, stated that there are ridiculously simple questions about the cortex that we just can't answer. In his book, How Everyone Became Depressed, Edward Shorter writes that depression is classified as a mood disorder, but in all actuality, it affects the entire body, making it more accurately a nervous disorder. Today, I would like to examine what is currently known about depression, its possible causes, and current treatment methods, as well as new information that is available about potential causes of depression and how current treatment plans can be best modified. In 2002, USA Today reported that 19 million Americans suffer from depression, making it the second leading chronic illness in the U.S. Symptoms of depression range from feeling sad and irritable to being tired and anxious. Surprisingly, depression can also cause argumentative and aggressive behaviors, as well as physical symptoms such as headaches and stomach aches. Now, in general, health professionals agree that depression is caused by a combination of genetic, environmental, psychological, and biological factors. Carolyn Gregor wrote an article for the Huffington Post in which she interviewed a psychologist who suggests that depression may actually be the symptom of an infectious disease caused by certain parasites. Even without knowing the exact cause of depression, there are many successful treatment options available. These range from a variety of different types of therapy, exercise on a regular basis, and exposure to bright light for one particular type of depression. And in some cases, antidepressant medications can also be prescribed to help treat depression. In an article for Discover magazine called Depression's Dance with Inflammation, Karina Storrs mentions that almost a third of patients don't respond to antidepressant medications. These patients may need multiple adjustments to their prescription to find what works best for them. Neuroscientists are continuing to study the brain, and as they do, they're noting all of the differences between a quote-unquote normal brain and one of a patient who suffers from some type of mental disorder. Carolyn Gregor of the Huffington Post asks, could depression be caused by inflammation? It's been long known that depression patients tend to have higher levels of inflammation in the brain. Now, previously, doctors believed that the inflammation in the brain was a result of a depressive episode. But new information is actually showing that depression may be caused by the inflammation in the brain. In her article, Depression's Dance with Inflammation for Discover magazine, Karina Storrs points out that some inflammation can be beneficial because it increases the levels of cytokines, which are the protein that promotes healing. However, recent studies have shown that increased levels of cytokines may actually cause depression. Now, it should be noted that only a fraction of patients suffering from depression actually show higher levels of inflammation in the brain. However, the patients that are showing higher levels of inflammation in the brain tend to be those who struggle to find an antidepressant that works for them. Now, for those of us with limited medical knowledge, it may be difficult to see the importance of this new information. Karina Storrs writes in an article that anti-inflammatory drugs have been shown to reduce cytokine levels. So in essence, what this new information is telling us is that it may be beneficial for patients who are struggling to find a treatment that works best for them to actually use a combination of anti-inflammatory drugs and antidepressant drugs. And it's important to note that depression is still classified as a mental illness, and therefore any prescription medication, whether it's a combination of anti-inflammatory and antidepressant drugs, still needs to be used with other non-medicinal treatments such as therapy. As the second leading chronic illness in the U.S., depression affects millions of people, regardless of their age, gender, or race. Depression is classified as a mental disorder, but it does affect the entire body. Most patients can alleviate their depression with a combination of therapy, exercise, and medications. But there are some patients who struggle to find an antidepressant that works best for them. This new research has shown that depression may actually be caused by inflammation in the brain, and that current treatment plans can actually be modified to include anti-inflammatory drugs to help alleviate for those patients who are struggling to find something that works. My best friend is one of the most amazing people I know. Watching her struggle with her disorder has been terrible. She is, unfortunately, one of the patients who does not respond well to antidepressant medications. Discover magazine calls the brain biology's greatest unsolved mystery. It is my hope that with this new research and technology, that we will be able to solve the mystery that is the brain and help patients suffering from depression recover.